Everybody wants to know, how can you have the results of a facelift without going under the knife? Well, I've got the secrets for you in this video today. My name is Dr. Anthony Yoon, and I'm known as America's Holistic Plastic Surgeon. I help health-conscious women over 30 look their best by teaching them a holistic approach to health and beauty. And today I'm going to show you the secrets of how you can get the results of a facelift, or close to it, without going under the knife. So this is a must-watch. So what is the problem? Well, the problem is as we get older, both men and women, we get droopiness of our face and our neck. And how many people have I seen in my office? It seems like every day they come in, they say, Dr. Yoon, I just want to look like this. I look in the mirror and I pull my neck and my face up. Can't you do this for me? And can you do it without going under the knife? So today I'm going to show you how you can get something like that, okay? You can't necessarily get a facelift without a facelift, but how you can get as close to that as possible without going under the knife and risking actual surgery. And I'll tell you when, unfortunately, surgery is your only real option. So the first thing you want to consider, especially if you're younger, is a retinol moisturizer. Now this is my brand, Yoon Beauty. If I were to pick one anti-aging cream that everybody should use, that is it, a retinol moisturizer. Now once again, this is my brand, but there are retinol moisturizers in pretty much every major skincare line that there is. And whether you choose mine, which is made with natural and organic ingredients, or another company, that is fine, but definitely would recommend a retinol moisturizer. So that's really the first step. So if you're younger, if you're in your 20s, your 30s, and your 40s, and you say, well, I'm just starting to notice a little bit of looseness, definitely start by applying a retinol moisturizer. You want to apply it every night as long as your skin is tolerating it. If you get some redness or some dryness, try to stick with it if you can, because typically that reaction will subside. Well, what's the next step? Okay, if you're on the younger side, you're starting to notice things getting a little bit loose, there are radio frequency treatments that my office has and other offices across the country that are completely painless and non-invasive. We have one called Refirm, there's another one called Pelave, and there's still other ones across the country. And these are radio frequency treatments where they basically heat the deeper skin to a certain temperature to cause the collagen in the skin to tighten up, okay? The great thing about these treatments, once again, is that they're mild, they're not super expensive. Sometimes you can get them done for a couple $100s for a treatment. There's no downtime with it, and you can definitely see and feel some changes. But the negative is it's not super powerful. So if you've got a lot of drooping, then don't waste your money on radio frequency. Really, this is for people who are in their 30s and 40s and they're looking for some mild tightening just to kind of get them, maintain what they have and maybe get things a little bit tighter. Well, if that's not quite doing it and you want to take the step up from that, then I would encourage you looking into a fractional laser. And most skincare companies have some brand of fractional laser. And what these lasers do is that they target the deeper skin by lasering or heating it up. Okay, it's a bit more invasive or a bit more painful and aggressive than the radiofrequency treatments I just mentioned. But with the more aggressiveness, you get a bit more tightening. So if you're in your 40s and if you're in your early 50s and you don't want surgery and you want something that's fairly quick and easy, not super painful, then a fractional laser may be a good option for you. In my office here in Metro Detroit, we have a non-ablative fractional laser. The downtime is typically less than a day, and it's the Icon 1540, and that's a great laser for just getting some mild tightening, more than what we can get with radiofrequency, but not as aggressive as some of these next treatments. Well, another option is to inject Botox into the platysmal band. So this is Botox. It's the most common, most popular cosmetic treatment in the country. And in those people who say, you know what, Dr. Yoon, I've got these bands in my neck that move when I talk. How can I smooth those out? Botox is a great non-surgical way to do it. So what we typically do is inject Botox right into those bands, okay? I typically inject it about every centimeter or so all the way down the band for a total of anywhere from 10 to 15 units of Botox. By injecting it into those bands, it weakens the muscle that creates those bands, and in a lot of cases, it can cause the neck then to smooth out and those bands to soften. When they don't work, however, is if there's a lot of loose skin around it, okay? Because then that loose skin takes over, and whether the muscle is relaxed or not, you've got that hanging, okay? So this is great for people who have reasonably good tight skin, but they've got these bands that they just don't like. Then Botox, great thing to try. Lasts about 3 to 4 months. Okay, now we're getting a little more aggressive, okay? So let's say you say, look, I'm not in my 30s, so radiofrequency would be somebody in their 30s. Fractional laser, you're getting in your 40s and 50s. And you say, look, I want something a bit more aggressive. I'm in my 40s or my 50s, and I really want to get some definite tightening, but I don't want to have surgery. Then microneedling with radiofrequency is that next step up, okay? There's two brands that I have here, Fractora and Vivace. And these are very well known. And so if you've ever had microneedling, basically these little needles that go into your skin, it's the same thing, but those needles are supercharged with radiofrequency to also create heat after it goes into the skin. And so by creating that heat like a fractional laser, it can help that skin and the collagen to tighten up. Now this can create some redness. It can be fairly uncomfortable, so usually topical anesthetics are used for it, but doctors are finding that they can get some reasonable tightening with it. Once again, this is something good for somebody who's in their 40s and maybe early 50s and are looking for some non-surgical tightening. And then we have Ultherapy. So if you were to ask me, Dr. Yoon, I don't want surgery, what's the most aggressive way to non-invasively tighten my neck? Then I would say it's probably Ultherapy. Ultherapy utilizes ultrasound energy to heat up the deep skin to cause that skin to tighten up. Okay, so all of these, whether it's radiofrequency, lasers, or microneedling with radiofrequency, they all function by creating heat into the deeper skin to cause the collagen to tighten. Ultherapy does it with ultrasound. Now, Ultherapy, even though I do recommend a lot of patients for this procedure, I'll tell you it doesn't work in everybody from what I've seen. The satisfaction rate isn't 100%, but it's about as aggressive as you can get. And the other thing with Ultherapy is it can be fairly painful for some people. Because it's not treating the surface of the skin like the other treatments are, there's no way to really numb it up. And so it can be fairly uncomfortable for people. Ultherapy sometimes is done under a sedation, okay? But if you don't want any invasiveness, but you want some tightening, Ultherapy may be worth a look. And now we're getting into a little more invasive. So if you don't want an actual facelift, but you are okay with a surgical procedure, then FaceTite is probably the best thing right now. And what I mean by that is what this procedure does basically is you make an incision, typically in the chin here, maybe some incisions back here and here. And this is a tiny probe that goes under the surface of the skin as well as on top of the skin to heat the skin from the inside out. All right, so these other treatments that I've talked to you about are all heating it from the outside in, only the outside in. FaceTite heats the skin both on the inside and on the outside as well. And so it's that 1-2 punch that can get more tightening than Ultherapy and these other treatments that I've mentioned. But it is surgery. It's not a facelift, but it is surgery. And it's quite expensive because the device itself is very expensive to purchase. So if you don't want the scars of a facelift and you're wanting to get some tightening of your neck, then FaceTite may be an option for you if you're open to spending a good amount of money and having a minor operation. All right, so when is a facelift your best option? Well, full disclosure, I perform on average about a facelift a week. So I do a lot of facelifts. And so even though I've given you a lot of options on how to prevent and how to, prevent using a facelift to get yourself better, sometimes the only real option is to go into the knife and have a facelift to treat your issues. So I tell my patients a facelift is your best option when you've got so much loose and hanging skin that those other treatments aren't going to do it. Okay, and unfortunately it really does take an experienced board-certified plastic surgeon to really be able to tell you, can you get with FaceTite what you're looking for? Are you going to be able to get with Ultherapy what you're looking for, or should you just go with the facelift? Now, typically what I would tell you is if you've got severe jowling, if you've got a lot of loose skin, that the skin is hanging, then those other treatments are unlikely to be powerful enough to get you a sharp jawline. Okay, they may get you some tightening, and if that's all you need, then that's fine. But if you're looking for a sharp jawline, if you look in the mirror and you say, this is the only thing that's going to make me happy, is literally pulling it up like this, and you're seeing everything move up, then it's definitely possible that a facelift is your best option. And if you're interested in learning more about it, I've got a lot of videos here where you can see the before and afters of facelifts that I've done, so you can see just what they started with and what they ended up with afterwards. So I would encourage you, if you've liked this video, subscribe. We've got a lot more great information coming to you. Take a peek at these other videos to learn more about how you can look and feel your best holistically.